Now we're going to move away from psychological therapies and into the biological or biomedical therapies. So we're on the back of that chart that you have. Just to clarify, we talked about this already in part one, is that biological is the more physical treatment. So we're mostly talking about drugs. Okay, so you've got to first understand the type of disorder and what exactly is going wrong. So for instance, with depression, it's a lack of serotonin. So what is the drug going to do? Well, it's going to somehow increase serotonin. So, but then we also have to know the side effects, right? So here's a chart. Whatever is in purple, you do not have. Anything that's in black, you already have. But I am going to mention a few things that I want you to write down. With the type here, antipsychotic drug, what kind of disorder are we talking about? Well, we're talking about psychotic disorders, which is schizophrenia. So whenever they're asking on the test about how to treat schizophrenia, biomedically, they're asking about antipsychotic drugs. So I would put under type schizophrenia or psychosis. The forms could be clozapine. You may have seen commercials for Seroquel or Risperdal or Zyprexa. All of these will block serotonin and dopamine. Okay, so most of them block the dopamine receptors as an antagonist. That's a big, huge review back from Unit 3. Usually seeing results in 4 to 6 weeks. Again, remind yourself what's wrong with a schizophrenic patient. They have too much dopamine. So what's the drug going to do? It's going to reverse that by being an antagonist and blocking the dopamine. These side effects are huge. It causes sluggishness, really what medicine nowadays doesn't, but tics and other involuntary bodily movements. So it's almost as if it's an induced Parkinson's or Tourette's syndrome, and you call this Tardive Dyskinesia. For some reason, College Board really likes this term. They really like this side effect, meaning they use it a lot on the test. So make sure you know that. Lowering of white blood cell count as well as weight gain. So on to the next type, antimanic. Where have you seen mania before? Manic depression or bipolar disorder. The big one, and please, please, please link in your mind, say it over and over again, memorizing bipolar, lithium, bipolar, lithium, lithium, bipolar. That's the main form of biological treatment for bipolar disorder. And it's effective in reducing the manic activity. It's very, very powerful, so you have to be careful not to reach toxic levels with it. Moving right along, antidepressant, obviously treating depression. Again, what's wrong? It's too little serotonin. Okay, so there's two types of drugs here to use, and you've probably seen at least one commercial for all of them: Prozac, Zoloft, Celexa, Lexapro, Effexor, Cymbalta. And the one type, the SSRI, will only block the reuptake of serotonin. Now remember, if it blocks the reuptake, everything that's left over will be sent again. Okay, so you can't have an undersupply of serotonin then. The SNRIs will block the reuptake of serotonin and norepinephrine, hence the N in there for norepinephrine. So it probably just depends on the severity of the depression. Dryness of mouth, constipation, headaches, weight gain. Again, all side effects that you normally would see with a lot of different drugs. Anti-anxiety drugs, so for OCD, for GAD, phobias, etc. Benzodiazepines like Librium, Valium, Xanax. So they reduce the intensity of responses to the stimuli. Okay, well, if they're reducing that kind of response, that autonomic response, it's probably going to cause drowsiness, hence one of the side effects. Electroconvulsive therapy, or ECT, there's no real quote forms. It's only used to treat severe depression. Pretty sure that's a test question, and they like it on the AP exam as well. But it's essentially electrodes placed on the scalp. It seems to reset the hypothalamus. Again, only used to treat severely depressed patients. The last one being a lobotomy or a psychosurgery. It's where they sever the nerves between the frontal lobe and the centers of inner brain structures. Some side